2022 regular meeting of the Burlington Board of Health to order. Please join me for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm Dr. Ed Weiner, Chairman of the Board of Health, and with me tonight is Mary Beth Welch, Andrea Sheehan, Dr. Wayne Saltzman, and from Minnesota online, we have Vice Chairman David McSweeney. Also with us this evening is Susan Lumanella, our Director of Public Health, Michael Green, Associate Director of Public Health, Christine Mathis, our Environmental Engineer, Marlene Johnson, our Health Agent, and taking and recording tonight is Dawn McDowell. Please note that we are live on BCAT and available for appropriate comments and questions through this video technology. And thank you to BCAT for all that you do for this community, keeping all us aware and so well informed. Thank you, BCAT. I want to remind everybody that tonight, since we have a remote member of the Board of Health, all votes will be roll call. Which brings me to approval of minutes. We have two, February 8th and February 22nd. Let's look at the 8th first.
Mr. Chair, make a motion to approve the minutes from February 8th, 2022.
I have a motion by Dr. Saltzman, second by? Second by Mary Beth Welch. All in favor? Dr. Saltzman?
Aye.
Mary Beth Welch?
Aye.
Andrea Sheehan?
Aye.
Dave McSweeney?
I need to abstain, Mr. Chairman.
I abstain, and I vote aye. 4-0-1, Ms. McDowell. And now we have February 22nd, 2022.
Mr. Chair, make a motion to approve the minutes from February 22nd, 2022.
I have a motion by Dr. Saltzman, second by? Second by Andrea Sheehan. All in favor? Roll call. Dr. Saltzman?
Aye.
Ms. Welch?
Abstain.
Ms. Sheehan?
Aye.
David McSweeney?
Aye.
So it's 4-0-1 again. Citizens' time. Is there anybody here who is not on the agenda or anybody online that would like to say something to this board or ask a question or address the Board of Health? Susan, do you see anybody?
No.
Then we will move on. Chairman's report. I hope that you're hearing me okay. As I do each meeting, I want to acknowledge our professional staff, board members, and all those town departments for your hard work, commitment to this town. It's been a long 2 years. I want to note that the Board of Health has worked very hard to keep Burlington safe and well during this historic pandemic. It's just part of what we do. It's not been easy for us. It's not been easy for the community, and I know it's not been easy for you. So on the behalf of the Board of Health, we thank you all for your support during this unprecedented time. Tonight is a special evening, a special meeting. We will thank 3 individuals for their work in assisting the Board of Health. Harrison Liang, our Board of Health intern, and Jim Harrison for his assistance as representative on so many institutional biosafety committees. But most of all, we will thank one of our own and dedicate this meeting to Dr. Wayne Saltzman, who is moving on in his career in life. After 5 terms of office, 15 years of commitment to the town, we are going to recognize Dr. And there's more to come, and we'll get there in a minute. At last, as I note each meeting, the Board of Health is here to discuss any questions that you may have. Our website is a great resource, accessible to everyone and anyone, anytime, and most important, we are always just a phone call away. As I do every meeting, if there's anyone, board member, who would like to add to my report, please. Okay, so we go to now subcommittee reports. Now, we don't have to vote on subcommittee reports, and this one involves, what do we have? This one is 43 South Ave. Mr. McSweeney, you were at that meeting. Could you please make comment? That's all we need is comment.
Yeah, we did meet at length with the applicant. I believe they're at the meeting tonight. And sorry for confusing or complicating the meeting tonight for roll calls. I apologize for that. But I believe the applicant is there this evening. We did meet, and actually, you'll hear during their presentation, I'm sure, but there was not, they're just changing or are adding the hazardous material handling. The facility is going to be a full hazardous or a biotechnology building. The structure pretty much remained the same. There is no, as there was some concerns around because it's a contaminated site, there isn't going to be any additional digging or a lot of movement of material or soils because none of the structures are below the surface except for some of the footings that need to be dug. They are going to comply with vapor barriers and for wastewater management. The existing structure that we approved and as part of the original structure is going to be able to handle that. So it was pretty much an easy meeting, and Ed and I both approved moving forward with the plan.
Very good. And I'll just check with my Director of Public Health. We do not need to vote. Is that correct?
No.
Thank you very much. Which brings us to applications. 43 South Ave, application for approval of a special permit and application for a minor engineering change. Please come forward. And please introduce yourself slowly for the recording secretary, Ms. McDowell.
Good evening, Mr. Chair, members of the board. For the record, Christine Hung from Reamer & Braunstein, an attorney for the applicant, the Gutierrez Company. With me tonight, I have Scott Weiss, who is on Zoom from the Gutierrez Company, and then next to me is Matt Heil, the LSP from Sanborn Head.
Okay. I'll leave this. This is listed for our Associate Director of Public Health. Are you going to present this, or will the proponents present this first?
I can jump in first.
Please, go ahead.
Give you an overview. This is a continuation of work that started back in '08. They had special permits with the planning board in '08, 2012, and 2016 that were approved, but hopefully this time we can break ground and finally finish the third part of the, I'd say, 43, 53, and 63 South Ave project that they had initiated. They're looking for the special permit and minor engineering change for a new laboratory specific building in the place of what used to be the old Maycom site that does still have some contaminants, groundwater and soil from the past. But we have proposed conditions to deal with any construction that might disturb that this time around.
Thank you. I'll ask the environmental engineer if she has anything to add to that.
No, I think Mike did it, and Christine can add.
I'll let the proponents speak.
Yep, so just as Mike was saying, this is really the final component of the development of the South Ave Planned Development District. So back in 2008, they approved the special permit to develop what's now known as the Keurig campus. And the special permit was amended back in 2012 and again in 2016 to develop this particular site at 43 South Ave for an approximately 187,000 square foot building with structured parking and on-site stormwater management. The use that was allowed for that 2016 permit was office, lab, research and development. Now we are adding additional use permits for hazardous materials and light manufacturing, and also a pad for a generator, a generator. So it's really just encompassing all of the permits to allow a life science facility to come, to come to the site. And as you know, in this market, having a permit in hand is critical at this stage, so that once a permit in hand, the tenant will come, and it's just the speed to the market. So really, that's all I have to say. Scott, did you want to add anything to this?
No, I think you covered it very well, and I appreciate that, and to the full board and everyone, this opportunity for remote technology is fabulous. Really, really impressive combination of in-person and remote. So thank you.
Well, actually, Mr. Chair, I do have one more thing to add, if that's okay. Just as Mr. McSweeney was saying, we did have a subcommittee meeting, and then also this morning, we had a department heads meeting with planning and staff and some of the Board of Health staff here. We have received the conditions prepared by the staff, and we're fine with them. And so, thank the staff for all their hard work with this.
Thank you. Well, anybody from the board who would like to make some comments? I got you a couple. Just to point out that there are 21 conditions, and one of the conditions, number 3, requires that the LSP must establish action levels for groundwater analysis. For construction, the report must be reviewed and approved at a regularly scheduled Board of Health meeting. That means that we will expect to see you again here before us in the future. There was a question whether we should look at this tonight, or we should postpone it, or we should continue it. But with the agreement that you will come back to us in the very near future, prior to construction, that I think that our staff and our board feels comfortable with doing this. I just want to make sure you understand that you will be coming back, because we don't want to have an issue going forward. And when I looked at this, it promoted some discussion. However, I feel comfortable that you will be coming back, and I know, Mr. Weiss, you will come back. So thank you so much.
Yeah, and I will just add, just in response to that, we recognize the conditions that have been laid out. Matt Heil, as Christine introduced, is our LSP. He has worked closely with the board and the staff in the past on the prior 2 buildings on this site, and has been involved with other properties in Burlington as well. So familiar with the requirements. We look forward to laying out the pre-construction plans and presenting to them in detail to you in the future.
Thank you very much. I have one
That's all,
question.
Mr. Heil, and that's all I have. There is a second LSP involved, correct?
Yes, there is.
Have you consulted with them yet, him, her?
We have. In fact, we're going to be speaking with them Thursday. But we've already introduced them to this final phase of the project. But we will work with them, especially with the action levels and deciding what we want to propose and have you folks review. But Tony Andronico remains the LSP of record for the ongoing MACOM-related cleanup.
As you noticed in number 21, in condition number 21, Any plan changes shall be submitted to the Board of Health to determine whether or not an appearance before the board is required, or you're coming back anyway. But if there are changes, please let either our Associate Director of Public Health or an environmental engineer make them aware of it so we can be prepared to talk to you about that. You have any other comments?
I do not. Look forward to getting this one rolling.
Ms. Hung, do you have anything?
I don't.
I'll ask the board for their pleasure here.
Mr. Chair, I would make a motion to approve the application for approval of a special permit and minor engineering change for 43 South Avenue,
With the 21,
which the 21
Conditions.
conditions as noted.
thank you very much. I have a motion and a second by, I'm sorry,
Just asking them to sign in. Sorry.
Mary Beth Welch. Any other discussion from anybody? Anybody here for our professionals?
I'm very happy to see, Mr. Chair, that this is one of the few times which we did not have to beg for a vapor barrier. It is condition number 8.
Well, we didn't beg, we order. I have a motion and I have a second. All in favor? I'll go through the list. Make sure I get everybody in order. Dr. Saltzman.
Aye.
Mary Beth Welch.
Aye.
Andrew Sheehan.
Aye.
Mr. McSweeney.
Aye.
And I vote aye. That's 5-0-0. Thank you for coming. We look forward to seeing you in the future, soon.
Thank you very much, and thank you to the staff for all of their help with this.
Yeah, thank you. It's good to see you all again.
And thank you. I appreciate everybody's role and thorough input on this. And with your indulgence, Mr. Chair, I'd just like to thank Dr. Saltzman for, the years of work that we've coordinated together. And it's been a pleasure to work with you guys, all of you, and certainly Dr. Saltzman. You guys are not always easy, but you're fair. And the town is very, very lucky to have had the 15 years of your service. So thank you.
Mr. Weiss, thank you so very much. Appreciate that.
Okay.
Which takes us on to permits. 145 South Bedford Street, Northeastern Irrigation Well Permit. Who is going to represent Northeastern here? I will. Please come forward. And please, when you get there, please state your name for our recording secretary.
Good evening, everyone. My name is Cole Worthy. I'm a licensed site professional.
Please, could you spell your last name, please, sir?
Worthy, W-O-R-T-H-Y.
She's remote. Our recording secretary is
Sure.
remote. Thank you so much. Thank you, Mr. Worthy. Will one of our professionals present this?
I will.
Thank you. Christine Mathis, our environmental engineer.
Sure. So the applicant in this case is the well drilling company, and that's Ogden Well and Pump. And I believe Mr. Fitzpatrick is on the meeting remotely. And he is filing an application on behalf of the property owner, which is Northeastern University. They have submitted an application for 2 irrigation wells for the campus, the Burlington campus of Northeastern. A little bit of background, there was a former underground storage tank release at the site. Analysis has been done by the LSP regarding that former disposal site, which I'll let Mr. Worthy speak to. Also in the area, as you know, there are some other disposal sites, the closest one being the former high voltage Gallifram site. Mr. Worthy has also done some analysis in terms of any impact on the wells, irrigation wells from that site, and he can go into more detail on that. That's it. I'll turn it over to Mr. Worthy for a little more detail.
Mr. Worthy, you have the floor, and
Sure.
you are the LSP and a senior associate. I have it in front of me.
Yes, I am.
Please.
And I'm also joined with my client, Gina Kerwin, representing Northeastern. She's on the
Seeger.
line.
And Glenn Fitzpatrick.
And Glenn Fitzpatrick with the
Thank you.
Ogden Drilling Company as well.
Thank you.
So I guess I can Can everyone see this okay? I guess I could speak to the closed-out release, which is the pink area, which was where the underground storage tank was located. They did remove the tank back a while ago, collected confirmatory samples, and was closed out under the MCP, the Massachusetts Contingency Plan. I was not the LSP of record for that, but a prior LSP did close the site out with a permanent solution statement with no conditions. And it was really limited to just, I would say, surficial contamination within a 0 to 8 foot depth. So really, I don't think the proposed well will have any impact for that surficial contamination, since we're going to be, putting a bedrock well at significant depth down to about 800 feet. And I will say that, the plan is to put in one irrigation well, and if during the drilling program and some of our pilot testing program, it looks like it's not going to yield a lot of water, we will, in fact, put a second well in. So hopefully we'll just have one well versus two. I just want to make that clear.
I just want to, understand you'll have to come back for another permit for the second well, because this is just for one irrigation well.
It's just for one. Glenn,
It's
did
for
you hear
two.
that okay, Glenn?
It's for two, they applied for two?
Yes.
Two.
Okay. So the sampling, all the conditions will apply to both wells?
Will they have to come back?
No, not if they applied for two.
Are you changing?
I
No,
thought it was
we're
one.
applying for two. I was just informing the board and the members here that if the well does look like it's producing a lot of water, we may just elect to go with one. But certainly, if it's not and we're unsure, we'll put in the second one.
Do we have the locations for both of them on the plans?
They are right here, these black circles right here.
So they're right next to each other?
That's correct. And right now, this was the location of what I believe were former basketball courts, which is now a landscaped area just off of the newly constructed building number 5, which is here. And it's just off to the east here.
And this is for greenery only, for keeping irrigation?
Yes.
Thank you. So it's 2 wells.
And the production of the wells, we're anticipating that they would operate, typically in the evening or early morning for about 6 hours per day, about 40 gallons per minute, about 15,000 gallons per day, which is pretty typical for irrigation wells. It seems like a lot, but it's just for a short duration for a 6-hour window.
Anybody have any questions for Mr. Cole, for Mr. Fitzpatrick, or Ms. Gina Kerwin?
Mr. Chair?
Yes, please.
It isn't so much about the digging or anything else like that, just the understanding that the functioning of the well still falls under the jurisdiction from the selectmen with regard to water usage. And if there are restrictions on water usage, that this does apply as well to this well. I just want to make sure that your group understood that. So if we're at every other day watering or whatever the restriction is, that also falls under the purview for you all.
At least for the near future, we depend upon the aquifer for our drinking water. And therefore, if there are drought situations, 2 things happen. Either there's a schedule for withdrawal, and does that pertain to this?
Yes.
And also, if an emergency drought situation is called, then you cannot pump, correct?
Yes, they have to, as Dr. Saltzman was saying, adhere to any restrictions that the Board of Selectmen deem necessary.
But it's our condition about if there's a drought.
It's in our regulations.
It's in our regulation.
They need to adhere to the Board of Selectmen.
Okay, so if there's an emergency situation, you can't pump. Okay? I just want to make sure right up front, that has deterred a lot of people from putting in these wells.
I don't have control over that, but my client will certainly.
Yeah, no, I was just bringing it up, and I know you didn't. I was just bringing it up so that the community could hear that we were advocating for the same level of fairness across the board that needs to exist for commercial and for private citizens.
Okay, understood. Thank you.
And hopefully that won't happen. Any other comments? Anybody else? All right.
Yeah, I just want the board to, just want to point out that there is a requirement in the conditions for sampling for, I believe it's one season, 3 times,
Correct.
for VOCs.
VOCs and one for
Yeah,
dioxin.
due to the proximity of this to the RTN number across the street, because that contamination is also within deep bedrock.
Now, I don't see the condition.
I don't
on-
see that one.
Yeah, I didn't see the conditions
Was that
on the
added?
document that I have.
I don't either.
That would be condition 2.
I have not seen these conditions at all. I was not aware.
Oh, yeah, I do, I see. The first season of operation.
They're on there.
It's number 2, you're right.
Okay, number 2, yep.
Yep.
Okay, yep, I see it now, okay. So,
And I just want to make sure that they understand the condition and the requirement and your client understands as well.
They're informed, yes.
okay, so if there are no other, I'm looking for a motion to approve with the conditions.
So moved.
I have a motion by Mary Beth Wells, second by
Second.
Andrea Sheehan. If there are no other discussion, all in favor? Dr. Saltzman.
Aye.
Mary Beth Welch.
Aye.
Andrea Sheehan.
Aye.
David McSweeney.
Aye.
And I vote aye, 5-0. Thank you very much for coming, Mr. Worthy, and Glenn Fitzpatrick and Gina Kerwin. Thank you all for coming. It was 5-0 in favor. Thank you.
Thank you very
Good
much.
luck.
Thank you.
Nice to see you again.
Nice to see you again. Did you sign in?
I did sign in, yes.
All right, it brings us now to discussion. And I want to acknowledge our Board of Health intern, Harrison Liang, and I will allow our Director of Public Health to talk about how great you were. We see you, so wave.
Yes. So I'll let Harrison talk a little bit about his experience, but I just wanted to say thank you to him and let the board know all the things that he's worked on. He began with us several months ago, and he started working on the social media and the newsletter for the BVRC. We started with a new software program for an online type of newsletter, and Harrison got that up and running for us. He put all of our BVRC volunteers into the database, did an article, set up the first newsletter and sent it out, and it was very successful. And now we're continuing with his work and continuing sending out the newsletter on a monthly basis. So he started with that. Then we got really busy with COVID case management while he was here, and he started doing case management and case investigation and contact tracing for us. And he came in for several hours every week and called people and spoke to them and gave them isolation and quarantine information, and just was extremely professional with everyone. And I hope that was a good experience for him. He can tell you a little bit about that from his perspective. Then that went until about the beginning of January or so, and then he started working on the health fair stuff for us, did posters, and started calling people, trying to get vendors for the health fair that we're planning in May. So he's done all kinds of things, and has gotten a really good perspective, I think, on local public health and what we do, and he was great, and I just want to thank him for all his work.
Thank you very much. Well, Harrison, tell us about yourself. Tell us about what you'd like to, you're going to graduate in May. Tell us what you're interested in doing.
So I'm actually a junior this year. So I won't be graduating this May. I'll be graduating next May, hopefully.
Okay.
But yeah, I'm a junior at Boston University. I'm currently majoring in health science, minoring in public health and psychology. I'm interested in pursuing my master's in public health and epidemiology as well. I'd like to say I really enjoyed my time working as an intern for the Board of Health in Burlington. It was a great experience. I certainly had a lot of exposure to tasks that range from more administrative things like Susan mentioned, basically everything that I worked on, coming from just doing newsletter stuff and emailing stuff and organizational things like helping set up the annual flu clinic at the Memorial School, where I also volunteered as a medical scribe. Um, and then when she hired me as a contact tracer, I certainly had a lot more exposure to more public health center tasks, where I had to get trained using Maven, which is like the Massachusetts infectious disease monitoring website, I guess, or database. And in general, I think my time as the intern at the Burlington Board of Health definitely provided me with a range of tasks, which I was very grateful for. And overall, I had great interactions with everybody in the office. I worked really closely, mostly with Chris Pollock when I was doing contact tracing, specifically for public school students. And then most recently with the public health fair with Mike and Sarah. And overall, it was a great experience. Yeah.
Thank you very much. Now, when is he leaving?
This is marking the end of his internship. He's got lots of things in the works, so he's really busy.
Well, all I have heard is wonderful things about you. And I want to thank you so much for coming here and so much for doing what you've done for this community.
Yeah,
Does
thank you so
anybody
much.
have anything else?
I'd say that list that's a lot to accomplish. It sounds like went above and beyond what you typically assign.
Thank you so much, and good luck next year.
Thanks so much.
Harrison, do you have additional ties to this community? Is your dad's name Sam?
Yeah, Sam Lang.
Or it's who went to Burlington High School. So yeah, that's right. So no, great to have you. Thank you for giving back to your native community. Thank you very much.
Thanks so much.
I'm going to do something we never do, but I'm going to ask the board for a motion to direct the Director of Public Health to write a very positive letter to Boston University describing the outstanding work of Mr. Liang. So could I have a motion, please? We usually don't do this, but this is extraordinary.
Mr. Chair, I make a motion that our director write a very positive letter that the Board of Health formally acknowledge Harrison Liang for his dedication and work towards the Burlington community as part of an internship for the Burlington Board of Health.
Second that.
Have a second. Motion by Dr. Wayne Saltzman, second by Ms. Andrea Sheehan. Roll call vote, Harrison. Dr. Saltzman.
Aye.
Mary Beth Welch.
Aye.
Andrea Sheehan.
Aye.
Dave McSweeney.
Aye.
And I vote aye. 5-0-0. Thank you so much for all you've done.
Thank you so much. I really appreciate it.
We wish you well. Next is late hazardous material registration form. I guess we can cancel that, environmental engineer.
Yes.
You scared them all into compliance.
With Sarah's help, they were scared into compliance.
Thank you very much. We will not be entertaining those. Tonight, we're going to hear a presentation on FDA Voluntary National Retail Food Regulatory Program Standards, presented by our health agent, Marlene Johnson. And I believe you received a grant around this particular agenda item. And I think it's important for the community to hear all about this. So
Sure.
thank you so much, Marlene.
You're welcome. So it actually has a nickname, and the nickname is Retail Program Standards, because that's a mouthful to have to say when referring to this program. So Retail Program Standards. And the program is designed by FDA to help food regulatory agencies improve and build upon existing programs The goal of these programs is to reduce or eliminate illnesses and deaths from food produced at retail food establishments. The benefits of the program are to identify areas where the Board of Health can have the greatest impact on retail food safety, promote wider application of effective risk factor intervention strategies, assist in identifying program areas most in need of additional attention, improve industry and consumer confidence in food protection programs by enhancing uniformity within and between regulatory agencies. So the Board of Health applied for a base grant and an add-on membership grant. The Board of Health was approved for both grants, and we were awarded a total of $19,000. So the grant money will be used to pay for a food consultant to conduct the verification audits on completed standards. So that is required, and that's probably going to be where a lot of the money is going to be spent, because they do cost money. Purchase 2 tablets with data plans to be able to conduct inspections in the field using food inspection software. Purchase or upgrade equipment and supplies used to conduct food inspections, such as thermometers, pH papers, flashlights, sanitizing test strips. Purchase audio equipment to be used for trainings. I'd like to take advantage of using the Grandview, the first floor ballroom. It's a huge room, but we need some audio equipment to be able to have good presentations there. And also pay for travel expenses to meet with the mentor assigned to us. So the program works by establishing 9 standards. There are 9 standards, and health departments start with 2 or 3 standards that would best benefit their food program. Work with our mentor to guide us in completing the standards. Once a standard is met, and that being met would mean that it was verified by the verification auditor, such as the food consultant, and reported to FDA. The program runs for 1 year. It ends December 31st, 2022. And then there'll be an opportunity to apply again next year to complete more standards. So the mentorship program. Burlington is matched with Chatham Health District, which is located in Connecticut. And our mentor is Jamie, whose district is Marlborough, Connecticut. Mentors have experience with and have completed all 9 standards in their jurisdiction. Mentors provide advice, guidance, and resources to help other health departments to complete standards. And we are required to meet virtually, and we have to meet at least once in person. And we've already got that date reserved. Samantha Hardy, the Associate Health Inspector, and I will be going down the beginning of May to spend some time with our mentor in Connecticut. So the standards that we chose to concentrate on are Standard 1, 3, and 4. Standard 1 is the regulatory foundation. So this is a comparison between the most recent FDA food code, which is the 2017 version, and Massachusetts' current food regulations, which is 105 CMR 590, which actually has incorporated the FDA food code 2013. So we have to make sure that we are able to bring our regulations in line with current FDA food code 2017. Right now, there are about 4 or 5 sections of the 2017 food code that the Board of Health may need to adopt to meet the requirements of Standard 1. I'm working with the Food Protection Program, and I think that because we are enforcing 2013, that we actually might be considered in compliance. So I just need to get some information from them regarding that. So that would be good. That means 1 standard down. Standard 3 is about inspection programs based on HACCP principles. And HACCP stands for Hazard Analysis of Critical Control Points. So when we do our inspections, we need to identify risk factors and interventions, use of inspection report, using in compliance, out of compliance, not observed during the inspection or non-applicable. Documentation of compliance and enforcement activities. Assigned food service establishments into 3 risk groups based on type of food preparation and/or population served. So for example, highly susceptible population, such as a hospital, that would be either in risk group 2 or 3. A convenience store where they do no food preparation, that would be a risk category of 1. So we would put all of our food establishments into one of the 3 risk groups. Written policies for variances, validation of HACCP plans, on-site correction, and follow-up activities. We do all of this now, but we don't have it in writing. So that's what we'll be concentrating on, putting our policies in writing. Risk factors. So when we talk about risk factors, there are 5 risk factors that can contribute to foodborne illness. Food from unsafe sources. So that would be the manufacturer, distributor, or wholesaler. Are they licensed? Are they being inspected by FDA, USDA, or a state or county agency? Poor personal hygiene. Employees washing their hands, not coming into work sick. Inadequate cooking temperatures, making sure that raw foods are cooked to the proper final cook temperatures as outlined in the food code. Improper hot and cold holding temperatures, again, making sure that they're being held at the temperatures outlined in the food code. And contaminated equipment, making sure that clean equipment is not stored so it can get contaminated. Also, dishwashing equipment, wash sinks, that they're using them properly and that they have the test kits on site to test those. When we talk about interventions, there are 5 food code interventions, demonstration of knowledge, and this falls upon the person in charge. So when we conduct our inspections, can we tell if the person in charge is able to demonstrate knowledge, that they know the food code, that they're following the food code? Implementation of employee health policies. When we go to do an inspection, do we see an employee not washing their hands, somebody that looks like they're sick? Hands as a vehicle of contamination. Again, hand washing, proper glove use, time and temperature relationships. Is food being received at proper temperatures? Is it cooked at proper temperatures, hot holding, storage, etc.? And consumer advisory. Is the food establishment informing consumers if they have foods on their menu that are prepared or cooked, undercooked, or if the consumer can order food undercooked, that they know that there is a risk to foodborne illness. And then the last standard that we're hoping to accomplish this year is Standard 4, which is Uniform Inspection Program. So Samantha Hardy and myself, we do the majority of the inspections together. Uniformity among regulatory staff in interpretation of regulatory requirements, program policies, and compliance enforcement procedures. So that would be Samantha and I doing the same type of inspection, focusing on those risk factors and being consistent. Inspection uniformity to ensure inspection quality. And also having the equipment, required equipment to conduct inspections. Are there any questions?
Wow. You wrote this grant, you got the grant, you chose the standards, you're going to Connecticut. All I can say is that's amazing, outstanding, and as you have always been, amazing and outstanding for this community. I'm only going to ask one question, and that is, will you please come back at a regular meeting and update not only the board, but the community? Because I think the community needs to hear. They need to hear all the things that you are doing and our associate health inspector is doing.
Sure, maybe we both can
And,
come, maybe towards the end of the year when we have accomplished.
That would be great. That would be great. I really appreciate that. Does anyone else have any comment?
I thought what was good in the program too is that you said you can reapply, because, I mean, just to do these 3 standards in 1 year, but there's 9, right? So I thought it was great, but this was wonderful, thank you. It looks like a lot. I think it's great. It's a nice challenge.
We're looking forward to it.
I bet.
It's a lot of work, but it's also fun.
It is, but
So-
it's needed. Nice job, and
Thank you.
I want to
And Mr. Chairman, if I could, you start out this meeting, as you do most meetings, thanking our staff. And we are so lucky to have a phenomenal staff, and not all departments within the community are the same. This is just great initiative. It's extra dollars, which any community needs and uses, and to show the initiative behind this and taking the time to do this. Marlene, I can't thank you enough. But we are we're just so lucky to have such a great staff here in Burlington, and really proud of the work that's done here from the staff. So thank you. Thanks, Marlene.
Thank you.
I think so.
Just to add to that, I just want to commend Marlene for all the work that she has done. This was something that she brought to my attention, and she's been working on it now for quite a while, and as you can see, it is a tremendous amount of work, and she's going to be continuing doing it, and it's really going to fine-tune the way that we do inspections and really bring a lot, I think, to our inspections by her going through these exercises. So
I'd like to mention too, Samantha Hardy. She's very interested in this, and she's helped me go through some of these standards, because we have to do a self-assessment of all the standards. And she also has been a huge help.
It's nice that you add that. I also think too, we talk about this program has a mentor, but you're an amazing mentor for Samantha too, as well. So it's a good program. Thank you.
How long have you been with our board?
15 years.
15 years.
Yeah.
15 years. And I can't tell you how many times I have called you and said, I'm here in an emergency situation. Did I do everything okay? So thank you so much. But you're not running away because you have a report tonight.
I do.
Thank you.
So one thing I want to point out, if you haven't already noticed, that we did have a compliance check, and we had one tobacco retailer sell to a minor, or I should say
Can
to
we
a
hold
person
on
under
to that
21.
to your report?
Oh, sure.
Because I want to talk about that.
Oh, okay.
Okay, and that's really important that you explain that, so thank you. Something I've been waiting for is recognitions. We have two people to recognize this evening. The first person is my neighbor, Jim Harrison. Jim Harrison has served for over 15 years as a community representative on various institutional biosafety committees for a number of biotechnology and life science companies. Most recently, Jim served on more than 10 IBCs for such institutions. As a member of the Board of Health, Jim was instrumental in drafting the original Board of Health regulations for use of recombinant DNA molecules, which was the precursor regulation for our Board of Health biological science regulation, which is now in place. I want to thank you so much and wish you good happiness, good health, and most of all, I want to wish you, as a golf enthusiast, a third, not one, not two, a third hole-in-one. We have something for you, so would you please come forward? We want to take a picture, so why don't you come up here? And I want a picture with everybody, but I want to present you on behalf of the Board of Health. This is a token of our thanks.
Thank you, Ed.
Thank you.
Thank you very much.
You want to, why don't you shake my hand again? We got a picture. While she figures out the camera.
Camera?
That's good?
And sideways.
Very good. Thank you so
Okay,
much.
thank you so
Do you
much.
want to open it? Oh, jeez. Yes, we want you to open.
Tony, it's a bottle of Hazardous place.
Yeah.
Golf balls.
Oh, thank you
Well, that
so
would have been a good idea.
Oh, this is beautiful. Thank you very much. Nice little color.
It's really nice.
Thank you very much, Ed.
Thank you.
And thank you to the board.
Thank you.
Thank you, Susan.
Oh, let me get one more.
Okay. Thank you.
Just want to thank Susan for all the help and Christine.
Sure.
Been through a lot.
It's been a pleasure. It's been a pleasure.
And tomorrow will be my last one.
That's right. One more.
One more.
And thank you, Jim, for all your help and guidance. It's been a great opportunity to work with you.
It's been fun. I passed the regulation, and it's nice to know that, we're following up and
Yeah.
keeping our eye on everybody, but it's really good.
Thank you.
Thank you, Ed.
You take care.
Take care.
It's hard to believe that because of all that work, we are now a community that we are.
And now, we get to thank one of our own, Wayne Saltzman, MD, PhD. I want to make sure the community understands she is not only a medical doctor, but he's also a doctor of science. You've served Burlington for much of your adult and professional life. You're a nationally recognized physician and scientist, and you've given so much back to your community. 15 years as an elected member of this Board of Health, half of which as chairman. You provided so much medical expertise and public health to this town. You represented the board. You provided advice on BCAT during the pandemic, week after week, and on so many other forums. You are an extraordinary individual who has made a major impact on the future of Burlington. Personally and professionally, I will miss your expertise, your humor, your commitment, but most of all, your advice. All I can say is thank you. We have a presentation for you before you can make some comments on your own. We want to give you something, and I want to make sure we all get in that picture.
Okay.
All right? I gotta move some furniture around here.
Literally.
Holy smokes.
I hope you brought your big car.
Oh, my gosh.
You didn't ride your motorcycle, did you?
What? Oh, that's beautiful. Thank you, everyone.
It's a chair. It has the seal of the town of Burlington, and it's marked Wayne Saltzman, MD, PhD, Burlington Board of Health, 15 years of dedicated
That's very
service.
nice. Thank you. Thank you.
Director, how can we all get into a picture?
Maybe we can get Betty to take it, but Betty's.
Yeah, sure.
Up the front and then line
How
up
did you
here.
have the selectmen do it?
Bring a chair out.
Yeah, let me help with that.
I can. Are we all getting in? Okay.
Guess who's gonna sit in? Nice, you pop in.
I know some other people here would like to say a few words to Dr. Saltzman while he thinks about what he's going to say and say goodbye. So is there anybody else? I know that Mary Beth.
I would. Wayne, people are not going to remember how much work you accomplished, and they're not going to remember how many hours you worked, but they are going to remember how you made them feel. And thank you for always making me feel so welcomed and a valued member of the Board of Health. It's been a pleasure learning from you. I will miss your tremendous contributions to this board, your calmness, your sense of humor, and your jokes, well, some of your jokes. And every time I wash my hands, I'll be thinking of you, and you are truly going to be missed.
Thank you. Thank you.
Would anyone else like to say something? Mr. McSweeney, we talked.
Yeah, I do, Mr. Chairman, thank you. And Dr. Saltzman, I sincerely apologize. I wish I could be there in person to do this. I consider you not only a peer on the board, but truly you've become a friend of mine. And you're definitely going to be missed. You're going to be missed by the community. You're going to be missed in the Board of Health staff itself. And I am personally going to miss you for a lot of reasons, but certainly, even over, I would say more importantly, over the last 5 years, your guidance and support. We've had a lot of good conversations, and I appreciated every single one of those. And as everybody's already said, you wanted to say this, I am going to miss your humor. So I mean, I guess I'm not going to be the only one. So. And I know this is not going to be the last time we see each other, and I look forward to continuing our friendship outside of the Board of Health. But sincerely, you did a lot for this board, you did a lot for this community, and I don't think a lot of folks outside of the Board of Health realize how much you've done. But I do want to tell you this one thing, and this is very much a true story. As most of you know, my dad was on the board for 36 years. And Wayne and my dad overlapped, I don't know, maybe 8 years or so, 7 or 8 years, something like that. And when I first got on the board, my dad was off. When I first got on the board, my dad and I were pretty close, and we were having a conversation, and your name happened to come up. And I'm telling you, this is very much a true story. This is paraphrasing because I cannot tell this in Terry-esque form as he would. But he did say to me, he says, Dr. Wayne, Dr. Chairman, he and I don't always agree on stuff, but he's a really, really smart man. He always leads with integrity, and he knows how to run a damn good meeting. And that's exactly what my father said. So thank you for everything.
Thank you, David. Thank you.
Is there anybody else?
Yeah, I just want to thank Wayne for everything he's done over the years, especially in the beginning when I first became director and he was first chairman, and just the 7 years as chairman, he was just so much help. And I'm just so grateful that he's going to stay on as medical director so that I can still call him up when I need to, because I just have relied on him so much throughout the years.
Thanks, Susan.
Anybody online would like to, if not, the floor is yours.
I'm going to miss you.
Oh.
I put my words on paper.
So, Mr. Chair, thank you, and thank you to all. I'm not going to walk too far down nostalgia lane, but I was reminiscing as you were talking, Mr. Chair. If you recall, Ed Wall was the chair in 2007, and he moved out of Woburn, and there was an opening on the board, and I remember, and I think I was appointed, wasn't I appointed? I don't remember, but someone said, we could really value having a doctor, an MD, on the board, and I was appointed on the board, and it was always, I always said that when my professional life was stable, I was going to give back to the community, and I am a community advocate. There's nothing more important than the community and making sure that it is safe and well. And I sat where Andrea sits. The late Jimmy Dion was where Mary Beth is sitting. The late Terry McSweeney, David's dad, was chair. Ed was sitting here, and I forget who was sitting here, but the late Sharon Masterbrook was sitting there. Marlene was sitting next to her, and Heidi Porter was sitting where Christine is. And I was just thinking, I've learned so much on this board. One, I knew nothing. I knew nothing, nothing about drainage or anything else. And the things that I have learned here have gone beyond the purview of the Board of Health. I learned about leadership. I learned about being calm and even-minded from Jimmy Dion. I learned about being a fierce advocate for what you thought was right from Terry McSweeney. And I learned, I told my wife I wasn't going to get teary. And I learned about fairness from the chairman, from Ed Weiner. Ed took me out to lunch. It was what was Chang Wok and is now Sweet Ginger. When I was coming onto the board, and he kind of gave me the lowdown, and he's been a support and advocate and mentor and colleague and friend and for 15 years. So but I do believe, as I was a new flavor 15 years ago, I believe that the flavor of the board needs to be refined. It needs to be anchored, nonetheless, but it needs to be refined, and it needs to evolve with new thinking and new input. So, Mary Beth came onto the board to do just that. Then David, now Andrea, and there will be new face on the board, and I think that's good for the town. It's good to have fresh, new thoughts, and I welcome to see how the board continues to evolve. I have pledged to Susan that I would continue to be of support to this community in the role of, advocating for wellness through medical director duties, and I'm happy to do that. But I am very happy to see how this board has evolved, and I wish, I don't want to not think of Michael and Samantha as also new faces that have allowed for the board to evolve as well. So I thank you all. I'm not going anywhere, but I am looking forward to some new next steps. Oh, and by the way, Betty was sitting over there as our scribe. So, but I'm looking forward to some new challenges and to some new next steps in my personal and professional life. But I thank you all for what you have given me and 15 years.
Thank you so much. Thank you for everything. Where do we go from here? I guess we got to go to staff reports. Your last set of staff reports.
I'm ready.
You ready? Environmental engineer.
Well, this would be anticlimactic. One main announcement to make is that Household Hazardous Waste Day is coming up in a week and a half. It's Saturday, April 2nd, Francis Wyman School, which is located at 41 Terrace Hall Ave. If you have questions on what to bring, what not to bring, please visit our website and/or call the office. The website does have a comprehensive list and good links, but the office, we can also ask any unique questions that people may have. With that, I'll take any questions.
Questions from anyone? Just one Legionella case.
Yeah. So that was Chris Pollock, our public nurse, initiated that from a public health perspective. And then Susan asked me to get involved in looking into the potential source. So I investigated the establishment. They, on their own, had done sampling of the centralized water system. Yeah, it was an apartment type setting. And those results came back negative for Legionella. So it was a one case and no others.
Thank you.
Yep.
If there are no other questions, do I have a motion to approve the environmental engineer's report?
So moved.
Motion by Mary Beth Wells, second by Andrea Sheehan. All in favor? Dr. Salzman.
Aye.
Mary Beth Welch.
Aye.
Andrea Sheehan.
Aye.
Ed McSweeney.
Aye.
And I vote aye, 5-0-0. Thank you. The next thing on the agenda is the health agent, and it's such a privilege that you made it tonight for many reasons, but it's nice to have you providing your report in person. Please, is there anything that you'd like to highlight? And I know which one you want to do.
Sale of tobacco. The compliance check was conducted on February 20th, and out of all of the retail tobaccos, one sold to a person under 21, and that was AL Prime. So they were issued a $1,000 fine, and I did speak to the regional manager regarding that and explained that if another sale occurs within 3 years, the fine goes up, and there's a potential that they can have their permit suspended for 7 days, up to 7 days. So we do have a new gentleman that is doing the compliance checks, and so we're going to have him do them 3 times a year. So we want to get a little, and especially when we didn't have any done with the COVID, we had to put that aside. So we're kind of, anxious to get some more compliance checks done to make sure everybody's doing what they're supposed to be doing in carding. That's all that I have to highlight, unless there's any questions with my reports.
Any questions?
Please. Marlene, I just saw this on your report. One of the establishments is looking for a permit for cigars, so.
Oh, was it a restaurant?
Yeah.
Yeah,
Yeah.
so Landana,
Yeah.
They're changing their name to Moo. And so they want to sell cigars to their clientele, so they haven't opened yet. They're doing a little bit of renovations, and they're gonna reopen under the new name, and then offer some cigars at the table.
Okay, so you can smoke them at the table?
You can't smoke there, that actually,
Is there like
we'll have to package it, and they'll have to take it out.
Okay,
yeah.
that's what I assumed. I just wanted to ask.
Sure.
Thank you for
You're welcome.
confirming that.
Anybody else? I just have one question. It's a long time that we've seen a 1,000-gallon external grease interceptor plan that you had to approve. And that was for Jersey Mike's. That's interesting. Just a comment. If there's nothing else, I'll ask for a motion to approve the health agent's report.
Motion to approve.
Second.
A motion to approve by Andrea Sheehan, second by Dr. Wayne Saltzman. All in favor? Dr. Saltzman. Mary Beth Welch.
Aye.
Andrea Sheehan.
Aye.
Dave McSweeney.
Aye.
And I vote aye, 5-0. The next is Associate Director of Public Health. I got to get used to that, Mr. Green. Is there anything that you'd like to highlight?
Oh, I was invited to speak in front of the Chamber of Commerce regarding kind of the steps that we had taken to solicit new IBC community representatives since Jim Harrison was retiring. I think we were kind of under the gun as far as, losing our one representative and not knowing if we were gonna be able to find any others, so, just did a brief talk about that to the chamber, and, they seemed, very happy that we were able to drum up such interest and be able to move forward, rapidly with the new, biosafety biotech that's coming into town, so that was a good meeting.
Thanks. Does anyone have any questions for our Associate Director of Public Health? Just have one.
Mr. Chair?
Oh, please.
Thank you. Mike, it looks like you inherited our 210 Fox Hill ongoing saga. So can you tell me what's going on there? And Susan, I don't know if you or Christine even want to jump in, but is there, I think we had a conversation a couple weeks ago, is there something, obviously he doesn't or they don't care about the fines and or working with us to fix the issue. Do we need to take a second look? And it's just waste of time and it's aggravation and taxpayer dollars. Is there a way or something we can do to look at the regulation in order to fix this? This is going on for 3 years now, I think, or maybe even longer, the ongoing issue there.
So when we made the policy, we had this policy in place for repeat violations for some pumps that you work with us on, David. When we did that policy, that is something that we looked at, and I did ask town council about that. And what was stated is that, each violation is separate, and that for each violation, you would just do repeat fines, and that really is all that you can do with regards to the regulations, is just continue fining. And that's really all we are able to do.
And so maybe there's and again, we're hoping, I mean, we're not here to find people, right? We're hoping that we institute and also remind people through the order and the fine process that they need to do something different and to work with us. But is there an opportunity maybe to refine the regulation for circumstances? And, this is the first one like this since I've been on the board, and I'm sure it's the first one in a long time that anybody's encountered. So that it's either a real deterrent once they get to a point similar to this, maybe the amount of the fine, and or, I don't know what the answer is. I'm speaking off the cuff, but maybe there's something we can do in order to try to eliminate and minimize, us having to keep continuing to manage this.
The fine system is the non-criminal disposition, so the only amount that you can fine under that is the $50 fine for each day, each violation for each day. One thing that we could look at is just keep going back every day until it's.
Well, I mean, I don't think should do that. I mean, that's ridiculous, right? But so I guess we don't have the authority to change the fine amount to something higher and or put some other, maybe it's a question of town council. Is there something else we could do within our jurisdiction to deter situations like this?
When does it be considered an issue, or that it affects the other surrounding?
So, there's, in the regulation, there's two
Yeah, I
things
have to
that
go
you
back
can
and
do.
look at that. Yep.
There's the fine structure and there's injunctive relief. So injunctive relief would be in an emergency situation. So if there was icing down the street that we saw that when this first came to our attention, that's an emergency type of situation, and then you could go to the courts. You'd have to petition the court right away for injunctive relief for them to do something to kind of stop them from putting the water in the street right away. So those are the options under the regulations. I can certainly revisit it again with town council and ask them again, is there something we can do in the regulation? But all of our regulations, that the local Board of Health regulations, use the non-criminal disposition, which is the $50 amount. But I can certainly ask them, revisit this with them again and see if she has any other suggestions with regards to what else we could possibly do.
So how often do we actually go out and inspect? So is it a once a year fine, or every time the pump releases water?
Well, we're complaint-based, so when we get a complaint, that's when we go out and inspect. Okay. So if somebody calls to complain that the water's going to the street, we go out and inspect, and then we write a fine. Normally, we wouldn't write a fine for a first time. We'd give people a chance, but this particular case has been many times, so.
We're not we just don't want to keep fining and fining. We've got to find a solution.
Right.
I'd love to work with them in some way. I mean, we have provided them some direction in the past, but there has to be a reason why it continues.
So, I mean, Christine has had conversations with this particular homeowner in the past. I don't know if you have anything to add.
Yeah, and I laid out that it was as simple as permanently moving the hose, and the homeowner is, at the time, this was going back maybe a year or more, was of the belief that putting the hose in the front yard contributed to flooding in the backyard, and then contributed to water getting into the basement. And it also says in our regulations that they can seek connection to the stormwater system through a direct connection. I think that was may be cost prohibitive because it was quite a distance to the nearest storm drain. And, I mean, also, just from a historic perspective, Susan and I did go to court on this matter several years ago. And that was not based on injunctive release, that was based on the homeowner at the time challenged our violations. And the court found in our favor on 5 counts of violations. And that was, I don't know, 12 violations ago. It's been a lot. But
Yeah, and the reason we were in court is because the homeowner was contesting the fine. And now the homeowner
just pays them.
continues to pay the fines, so there's no reason to go to court, they just.
And to note that, I believe, Mike, you can jump in here, but the last go-round that you worked on was 3 fines, correct?
Correct, we did 3 fines, and that's when I talked to Susan about maybe going more frequently than once a week. So we decided, okay, we'll do it twice a week. And I did go back out, and it was actually moved. So the drain was moved to the other side of the driveway, off the driveway into the front yard. So it was discharging and hopefully infiltrating on his property, and that's when I did close out the complaint.
So let's begin to think out of the box, maybe bringing him in, maybe doing something, because I would like to fix it for him as well as fix it for us and the community. And there's got to be an innovative way of doing something, and let's think about it.
Yeah, and I would also recommend, Susan, if you could talk to town council, because we just don't want to be boxed into the corner like this again. And certainly, and we have welcomed and requested them to show up a couple of years ago to a board meeting so we could talk it through, and they didn't show. But I agree with you. I think we would love to work with the family and the homeowners to find a solution. I understand they have a problem, but that doesn't mean that they can just disregard the regulations. They're not special. There are other people in town that have a similar situation that comply with the regulations. So I think we've done, and we are open to continue to be open to discuss with them, to work with them to find a solution. But I just don't think their mindset is of such today. So I agree with you. I think we can reach back out to them. But Susan, I think if we could ask town council if there's more we can do in this rare circumstance, because I think 99.999999% of the time, working with the residents has worked. This is the one instance where it hasn't.
Thank you.
Are there any more questions? If not, I'll take a motion to approve the Associate Director of Public Health report.
So moved.
A motion by Dr. Salzman, second by Mary Beth Welch. All in favor? Dr. Salzman?
Aye.
Ms. Welch? Ms. Sheehan?
Aye.
Mr. McSweeney?
Aye.
And I vote aye, 500. And now we have the Director of Public Health's staff report, and that is made up of the supervisory nurse and the associate health inspector, and then the Director of Public Health, all under one. So first, are there any questions regarding the associate health inspector's report? I have none. The second, are there any questions for the supervisory nurse?
I just have one question, and maybe I missed it on here. The health fair, is it, and I know maybe it's directed at Michael, is there new programs this year, any that we might be able to discuss or share?
So the biggest new thing this year is that we're taking it outside on the common.
Yep, I'm
And
glad.
we're working with the rec department, and they're working on doing an adult and children's fitness crawl, where they're gonna have different stations. They'll have HIIT and Zumba and yoga, or different things going on for both adults and children around the common. And at the same time, we'll have our vendors on the common. Let's hope it doesn't rain. But we do have a rain date for the next day, so it's good weather. But that's gonna be in May. So that's the biggest difference. So Mike is working, and Chris as well, on trying to find new and different vendors to come to the health fair. We have what, we have like 40 now, or 30 to 40,
Yeah,
something like that
we're
now.
almost at 40 now.
And the date again for the
Which is the date,
May 21st.
May 20th, the week before, prior to Memorial Day.
Yep, 10 to 1.
Is it what?
yeah.
Very good. Okay.
Great, thanks for sharing that. I knew there was some new things. I think it's great to keep publicizing it.
Yeah.
Thank you.
I think,
It's gonna, logistically, it's, new for us, it's a challenge. So, but we did meet with the rec department and they do it with Celebrate Burlington, so they're assisting us and we appreciate that.
I have one other question, unless you have any. I just want to note that we are again doing bladder cancer screenings for the Burlington Fire Department, as we have done many times. And I think the community needs to know that we take care of our firefighters. So, and that'll happen soon.
Week after, I think it's next week, yeah.
Good. Okay, and now, the last is the Director of Public Health, Susan Lumanella. Does anybody have any questions for our director?
I just have one thing to add. So, one of the things that I've been working on is the NACCHO MRC RISE Award grant application. So, I just found out a couple of days ago, we were awarded that, so it's $25,000.
Wow.
Yeah, and,
Smokes.
so we're putting it towards trainings for our MRC volunteers, equipment, we've got badge equipment, we're getting some rolling carts to hold our medical supplies, to bring to EDSs and COVID clinics, and so there's quite a lot of things we were able to put into that. First aid bag for the volunteers to bring out to first aid stations, so that's good.
That sounds wonderful.
That's wonderful.
It's amazing.
That's amazing. Does anyone have any questions? Since it says Board of Health updates, upcoming events, and multiple calls, I don't think I need to ask any questions. Do I have a motion to approve the Director of Public Health staff report, which includes the supervisory nurse and the Associate Health Inspector?
Motion to approve.
A motion approved by Ms. Andrea Sheehan, second by Dr. Wayne Saltzman. All in favor? Dr. Saltzman?
Aye.
Ms. Welch?
Aye.
Ms. Sheehan?
Aye.
Mr. McSweeney?
Aye.
And I vote aye, 5-0-0. Well, it brings us to adjourn, but before we adjourn, I'm going to ask Dr. Saltzman to do his final farewell to the community. He always has some advice, some public health advice. Dr. Saltzman?
Thank you, Mr. Chair. I love the town of Burlington. The community is wonderful. It's been good citizens, been responsible during the COVID pandemic, and although the flu season's essentially over and things were relatively light, we know that there are risks that we need to be aware of, and we need to do the things that we know are right. So social distance, wash your hands, keep yourself isolated if ill, and just really be well, all of you. And I'm not really going anywhere. I still live here. Yeah. Happy to talk to anyone at any time. And I look forward to remaining in contact with our wonderful director, and we'll go from there. So thank you. Motion to adjourn.
Do I have a second?
Second.
Second by Mary Beth Welch. All in favor? Dr. Saltzman?
Aye.
Mary Beth Welch?
Aye.
Andrea Sheehan?
Aye.
Dave McSweeney?
Aye.
I vote aye. Godspeed, Dr. Saltzman. Good night, everybody.